All right. Well, welcome everybody. I'm Dawn Ellison. I am a member of the core group of Healthcare Reinvention Collaborative. And my co-hosts today are Lonnie Hirsch and Denise Wiseman, co-founders of HRC. The format today is will be familiar for those of you who have joined us for our events before. We're going to have an interview, and then we're going to go into breakouts, and then we're going to share something that we learned from the breakouts, and then there'll be a little bit of Q&A before we go into collaborative conversations after the first hour. So before we get started, my hope is that people remember that on this day, 23 years ago, and the weeks afterwards, we hugged our children a little tighter. We reached out to our loved ones and let them know how much they mean to us, and we united in our communities to support each other. My hope is that we remember we cared deeply for each other in those times, and remembering that, we do so again. At any time, if you would like to share your contact information or resources you found valuable, please feel free to do so in the chat. Our topic today is diversity, equity, inclusion, and belonging. We in HRC recognize that to facilitate and support the reimagining and reinvention of the current healthcare system to a future model infused with health and care that represents everyone, we will need to tap the collective intelligence and contributions that come from diverse perspectives. We have great people joining us for events as members and in our core group, and we also recognize the need to become more diverse. We want to be diverse in all the ways the US is diverse: gender, ethnicity, age, sexual orientation, culture, socioeconomic status, occupation, and thought. The question that we're discussing today is, how do we get there? So I'd like to introduce our guest, Dominique Grimes-Medlin. Dom is a seasoned HR DEIB consultant with over a decade of experience, currently partnering with Performentor and the Equity Paradigm to drive organizational success through inclusive people strategies. With extensive cross-industry experience and a SHRM certification, Dom specializes in examining policies through a DEIB lens, ensuring equitable hiring practices, and advocating for second chances, as evidenced by his statewide initiative creating a directory of justice-involved friendly employers in North Carolina. His commitment to diversity extends to his board service, including as vice chair for Step Up Durham, where he's raised over $270,000 through annual impact events. Originally from Indianapolis, this fashionable city boy is known for his extensive hat collection, love of red wine, and dedication to fostering inclusive environments where all can thrive. Dom, welcome.
Thank you, Dawn.
So Dom, as I stated at the top of the hour, we're really trying to be more diverse. And I know these questions are tough and there may not be any one answer, but how do we attract diverse perspectives? What can we do to attract diverse perspectives?
Well, first off, thank you for the opportunity to address the Healthcare Reinvention Collaborative today. As we discussed how to attract diverse perspectives, foster belonging, and enhance engagement, it's crucial that we ground our strategies in the realities of the healthcare system. So let's confront some sobering realities. Like, only 5% of physicians identify as Black or African American. So while they make up about 13% of the US population. When it comes to the Hispanic population, they make up about 18%, but only 5.8% of them are actually physicians. And then women, and so make up 76% of the healthcare industry. However, only 18% of them make up for the hospital CEOs. So these statistics underscore the urgent need of diverse perspectives in the healthcare leadership. So how do we attract how we attract these diverse perspectives to your board? I want to take a note from your website and to your mission, vision, and values, and so that we need to take a view from the balcony. So healthcare is a complex ecosystem, and our board should reflect. Your board should reflect this complexity. You need voices from every corner, and so that's clinicians, patients, and policymakers, technologists, and community healthcare workers. But you want to also take a step further You want to bring in perspectives from social services, education, environmental health. So like after all, only 20% of health outcomes are attributed to clinical care. So you want to be influenced by not only what's going on in the clinical side, but also the social and environmental factors as well. You want to embrace your philosophy and stuff that everyone's responsible. So this means making sure and stuff like that you're being intentional with your recruitment efforts. So like, not only recruiting individuals from diverse perspectives, but actually doing your research and knowing all those historical attributions to different diverse and marginalized groups and stuff have impacted them over the years. You want to spotlight and so like the greatness and stuff of underrepresented communities. So look at some of your local communities and local leaders and so that are actually doing this work and so in your area. So I can talk to them. A lot of this work is already being done and so like by many different groups. And so it would make sense just to take advantage and try to gain that wisdom and stuff of where they already are an expert in. You want to highlight and so your flat organizational structure and emphasize that all voices are equal and valued and so with your decision making process. And that's mainly and so what I would recommend so as far as attracting some diverse perspectives to your board.
So it sounds like there's some things that we could do on our website that would be helpful. Is that one of the things you're saying?
Absolutely. I would also so recommend so that people actually see and so pictures of who is on the board. They want to see that representation so of themselves. So even if it's not necessarily the most diverse, so we still want to highlight and so those diverse perspectives, those views. And so there's more than just race or gender or sexual orientation. There's different, there's diverse lived experiences that you want to highlight and so I can speak to and so on your website as well as when you're engaging with individuals inquiring about whether or not they're interested in joining your board.
So I've heard about a diversity statement. What is involved in a diversity statement, and would that be helpful to have on our website that would, help us to attract diverse perspectives?
Absolutely. A diversity statement just simply states that you encourage and so diverse perspectives, that you will not that your selection process is not solely deemed based off of race, religion, sexual orientation, so et cetera, et cetera. It means that you're welcoming to all and so individuals, so regardless of what marginalized group they represent.
And you mentioned, that we are working towards a flat organization, and I'm not sure how much we've emphasized that in our previous events, but we do in our core group make decisions with a consent-based decision-making process for the most part. And it sounds like that would be something to emphasize as well on our website and in our events.
Absolutely. People want to know that their voices are heard and not to mention that their voice matters. So the fact
Sure.
that you have this type of organizational structure would be a huge compliment to attracting diverse perspectives.
What do you think might be some blind spots that we have with respect to how to help people feel like they belong to the organization once we attract them? Sorry, I've got a fly in here. I may swat at it a few times. Once we attract them, what are some blind spots about that we might have about how to help them feel that they belong? What would you say is the most powerful thing to do there?
Well, for one example, you have to consider that 8% of the LGBTQ community and so report avoiding or postponing needing any medical care and so or actually disclosing the fact that they're of the LGBTQ community so for fear of discrimination or disrespect. So to foster belonging, and so you need to walk in that person's shoes. So and if you can't necessarily walk in that person's shoes, and so from your individual perspective, you just have to be inquisitive, be curious, and so ask questions. And so I promise you a lot myself, and so being of the LGBTQ community, I welcome questions. It's I am not fearful, and so of anyone asking if they may not understand or may not necessarily know all of the historical factors, and so that of being of the LGBTQ community and so in the healthcare systems that might have impacted. So you want to spend time in various healthcare settings. You want to garner firsthand experiences of the challenges faced by these different communities. And then you want to rotate into like leadership roles and stuff within your board. And so like you want to ensure that diverse voices are being heard and valued from different different leadership roles within your board and also within the different committees. You want to keep your messaging very simple, keep lines of communication so like open, and just be mindful of the communication that you're contributing to your board and so and how that may be portrayed. And so like especially when it comes to a lot of us now are communicating via email or text. So like I always urge my clients and stuff to always soften their approach when it comes to electronic communication, just because naturally most of us when we're receiving electronic communication are always going to be fearful of the worst. So we always want to be soften our approach. And so when it comes to non-verbal or not in-person communication with one another.
So something that I've learned in the last couple of years is about pronouns. Can you speak to the importance of listing pronouns?
Yes, absolutely. As you can see, and so like from my Zoom room, so I have my pronouns listed next to my name just to make sure. And also it doesn't help that my name is unisex. So oftentimes when people have not met me or are not familiar with me, oftentimes people mistake me for a woman. It's like I list my pronouns just to ensure and so that people are aware of how I would like to properly be addressed. And this is very welcoming, so especially when attracting members of the LGBTQ community. I know some people may feel some type of way. And so like when it comes, because obviously this is a concept that's very mainstream and very broad over the media and politicized and so like for quite a bit, but it's not a demonizing thing. So like to ask a person and so what are their preferred pronouns and so like and you have to it's just simply takes practice and so like once you do it enough and so like it kind of just falls into place and stuff when it comes to engaging with one another.
And for those of us who are, cisgender, if we let people know what our pronouns are, that makes other people comfortable to share theirs, right?
Absolutely.
Yeah.
And
So
also keep
what?
in mind,
Mhm.
sorry.
Go ahead. No, go ahead.
And also keep in mind and so we're going to make mistakes, so like everyone makes mistakes and so when it comes to engaging with diverse perspectives, even myself. And so like as a DEIB consultant, I find myself sometimes making mistakes, but we just have to own up to it and so like celebrate the failures and so like create a culture that is safe to share those challenges and learn from those mistakes.
So once we can, do a better job of letting people know that we are inviting diverse perspectives and perhaps helping, thinking of some ways to help with the belonging aspect. How do we keep people engaged? How do we keep them coming back and giving us their perspectives? Any ideas about that?
Yeah. So engagement is crucial when you consider stark disparities and so like in the healthcare system. So to enhance engagement, you want to involve all members in the decision-making process, which is another reason why I said to highlight instead of your flat organizational structure. And so that is a huge benefit instead to HRC. You want to implement things like project proposals and systems of which members and so like within your board and so it can not only help and so like HRC, but also their individual communities and their local communities and so as well. Addressing these issues like the 40% higher rate of preventable hospitalizations in rural resident areas. So you want to also apply system thinking to your activities and engaging members with collaborative problem solving sessions and address complex healthcare issues. And you want to embrace conscious capitalism, involving your board and so like providing opportunities for members to represent and so the HRC externally.
Tell me more about the conscious capitalism. I'm not sure I am familiar with that, or if others are as well.
So not it's more of a way, and so like to just make HRC more visible in the community. And so not only within their local communities, but also nationally, social media, spread the word. And so like, it's like about your group and what you're trying to accomplish. So like more people, I guarantee you, there are so many people that are wanting to support this effort, and so that you all are working towards that. It's like if you make a more conscionable effort to when you are engaging with partners, with and so like individuals in the healthcare field, with and so like your neighbors, your and so like with your networking events, and so like you want to make sure, and so you always have it in your basically in your back pocket, and so like to mention, and so like, hey, I'm part of this group, and so like it's the HRC, so like want to tell you about it, so like see if you might be interested, invite them to attend a board meeting, and so like see so like if they might be able to offer any input, and then also be interested in potentially joining the board.
And Dom,
Great,
my
thanks.
ears perked up when you said conscious capitalism, because of course that's something that we talk about often. Within this healthcare space, I talk about it being much more on the predatory capitalism side, where profits are really over people. And we're wanting to go to the other side, that capitalism can be fine, but when it's predatory, when people are excluded. So when we're talking about exclusion here, right, we want to be inclusive. Well, conscious capitalism means that yes, we can make a profit, but we're not pushing others out in the ability for us to make money, right? And so I loved that you said conscious capitalism. It just perked me up so much. So I have to say thank you for that.
Not a problem. Yes, and so like you have to, when you're working towards a mission, and so like that has the best intentions, and make sure that you are making a conscious effort to involve everyone in the conversation, so that you can't go wrong.
Great. Thank you, Dom. And it's time to go into our breakouts now. We're going to do about 3 people per breakout. If you aren't sticking around for the conversations in the breakouts, please let us know now. When you get into the room, introduce yourself briefly with your name, pronouns, and life's work, and try to limit your introduction to 3 sentences. So again, name, pronouns, and life's work. And then the discussion is going to be around what action steps can be taken to attract and include diverse perspectives to HRC that will impact how we can support the reinventing of a new health and care model. And one of the first things you should do after you go around and introduce is choose a reporter that will come back and share in the chat what you as individuals can do to bring diversity to HRC. So keep in mind, please assure voice equity by speaking with intention, to the point, and listening with attention, listening to understand. Be aware that the people in the room who don't need as much space between speakers before they feel comfortable jumping in will tend to dominate the conversation. So if that's you, take a breath after somebody finished speaking. So you'll have about 20 minutes in the breakouts. And if there's no questions, we'll jump into those now.
Can I just mention one thing quickly as we get ready to go into these breakouts? Dom has been speaking to the goal of having HRC increase diversity representation in our board. We're still forming a board. We have a core group, but really this conversation is intended also to have a framework for how we can increase diversity among all participants, all members who join or want to join HRC and be involved in some way in our work, or even in just supporting and following our work. So the conversations in the breakouts can also take that goal into account.
And we've copied instructions in the chat, so you'll have access to that those instructions there. All right.
All right. So it looks like we have 5. I am sure more than one person got pulled away mid-sentence. Sorry, Jerry. And
I see
else.
I am muted. Welcome back, everybody. Yes, I'm sure some people were mid-sentence. I know that happened in our group. So if reporters could summarize in the chat their group's discussion and ideas, we can do that now. So please enter into the chat any action steps that you came up with, or just summarizing the discussion so that HRC can, reach our goal of ensuring that the solutions and innovations that emerge come from the collective intelligence, knowledge, and life experiences that result from diverse perspectives. And Lonnie is going to read those as they plop in there.
Lonnie said discussion topics, more intentional outreach on LinkedIn outside our networks to achieve greater, it moved, and more diverse involvement.
Also, we talked about when you think about who is in your network, when you're being intentional about that, not just, in your own outreach to expand your network, how much diversity are you considering in who you're trying to reach out to, and not just diversity of maybe the more commonly understood categories of ethnicity and sexual orientation or age or gender, but also industry. How many? I think it was Jennifer who was, maybe it was Lori who was asking, have you looked at how many of your connections are inside the healthcare industry in some way, meaning either working in healthcare or working in some capacity on different aspects of or supporting different aspects of healthcare in terms of an industry focus, and how many are from other environments, because we're all patients and we're all at one time or another, and we all have people have personal stories that have them in some cases have a particular level of additional interest or commitment or passion around improving health, improving access to health, improving the healthcare experience. And sometimes we can get unconsciously insular just by the nature of who, or the way we write, if we're posting on LinkedIn or commenting on other people's posts, things, so that it kind of becomes self-perpetuating, narrower ecosystem. So thinking outside that framework is healthy and something I hadn't really consciously been thinking about as much before today's conversation. So I thought it was a really good thought.
So Don, we just had 4 groups. I wonder, we've got it in the chat, but I wonder if somebody's willing to, from each group, to verbally share it as well.
I was just about to say, Denise, that you're tapping. I've got mild ADHD, and I've volunteered myself, but then you've asked me to put it in the chat, and it's playing with my mind because I volunteered because I'm really comfortable verbalizing things. But as soon as you try,
go for it, Lee.
Writing, my brain.
Let's hear you, Lee.
Speak, Lee.
Yeah, we had a fabulous conversation, and thank you for the chance to attend today. It was 4 really different perspectives on this, which was great. I think one of the really loud and clear things that Sari's got experience of doing within her healthcare institution is addressing this topic by fully understanding the demographics of the audience that they engage. So it's really understanding what is the makeup of that audience and working out where do they feel that they've got good representation and where are the weak spots, and thinking about what does personalizing your communication, your engagement, your topics of choice, your slant on your overarching topic so that it connects with those arenas that maybe you've identified that you're underrepresented. And I think that's a really important point, because when we're talking about something like healthcare, certainly in the UK, the reason that the healthcare system is poorly accessed by people in certain underrepresented communities is because it doesn't do enough to personalize its service, to personalize its communication, its engagement. It doesn't do enough to meet people where they are in terms of the topic. And they just do a one-size-fits-all communication and hope that something sticks. And I think when we're thinking about HRC and its desire to have broader representation, I think that's an interesting action to take away, to think about, how do we change the narrative? How do we change the slant on how we're communicating the mission so that it resonates more readily with certain communities, because there'll be different elements of the mission that make more sense to different communities. So that was one point. And then the second point is, I suppose, my experience on conscious capitalism and diversity, equity, and inclusion is we have an operating model called Positive Human Impact that we've implemented at a board level in an attempt to hold ourselves accountable to the concept of conscious capitalism. So we aren't able to make a business decision unless we're confident that it has a positive human impact as a primary driver, and that any revenue and profit is as a secondary outcome as opposed to a primary outcome without considering PHI. And in line with that, we have a charitable arm of our business. which has formed out of a 10-year international charity development that I've led. So what we do is we invite the communities from the underserved communities that we're looking to understand perspectives. We invite people from our charity programs to join our board as non-exec directors. And then we have like a reciprocal value partnership with those communities so that we're providing resources to help them with their biggest community challenges, whether that's data, money, volunteer time, whatever it might be. And in return, the exchange comes back the other way so that they are able to come and feel valued and part of our commercial organization. And even though a lot of those communities that we work with don't necessarily have high-level business experience, they have high-level life experience. And so we plug our diversity, equity, and inclusion gaps by bringing those people into our conversation. So it strikes me that if I'm thinking about how to relate that into the HRC mission, if you like, it's thinking about what are the communities that we feel collectively are underserved and whose voices we want as part of this dialogue, and then thinking about where are those people currently voicing their frustrations, concerns, challenges with healthcare, and then finding the, if you like, the not-for-profits or the charitable organisations that are engaging with those communities, and then thinking about meeting them in that place rather than meeting them in our place, because I believe that a lot of the perspectives that will drive sustainable, genuine structural change to a healthcare system are going to need to come from people that won't be on LinkedIn. They're not going to be in our collective ecosystem. And as such, if we don't work out where we can go and meet them and make sure that we're understanding their needs and communicating right, we're not going to bring them into the conversation.
Yeah, Leah, I love that you're saying that, because to the one point, how do we expand our LinkedIn connections outside of our box? But LinkedIn itself is in the box. So how do we go beyond that? I think that's a really valuable point.
Thank you. Naomi, were you the reporter for your group? Would you like to verbalize that?
Hi, Don. Sure. I just finished typing it all up. You know how hard it is? I was trying to pay attention to the last speaker, listen and type. Yeah, so the group I was with, I was joined a few minutes late. Appreciate it. We talked specifically about understanding the generations that we need to incorporate. So we were looking at HRC as a movement, of course, that's like-minded focus, and we have a long-term vision across a continuum of healthcare. And as previous participants have mentioned, who's at the table besides us? How do we get the input? How do we understand the generational gaps, the technology gaps, to allow people to have their voice? Even if somebody doesn't have a voice or would not like to share it, but we do need everybody's perspective, because healthcare is community. Community is healthcare. And so there was some great examples from the members I had. If you can see that stat, we don't need to fact check. It's pretty mind blowing though. Only 40% of collegiate universities, not even healthcare, just any, are required to do cultural competency. And I don't know about you, but sometimes you can see what happens with formal organized training that's Zoom or Teams or on the platform. You lose some participation and you lose some of the good messages. People click, they figure out a way to answer and check box, and we really want to get away from that. The point is not to just say, yeah, here we are, we're DEI, we're community. We want people to actually live it, the lived experience, walking down the street. How do you approach somebody who's asking you for money? How do you approach somebody who you know that they need healthcare or services? It's this way, what can I help you with? So I think we all talked about, in my opinion, basically connecting, understanding, taking time. And there was a lot of great actions, but team, you can say anything if I missed it. I think
Anybody else want to add from that team? We're all good.
Well,
Right.
I think I was pretty good.
Oh,
I mean, I
thanks, Virgil.
appreciate you taking the attendance on that. I think from an HRC perspective, in healthcare reform reinvention, that's going to take a long time. And there's going to need to be a diversity of younger folks that we inspire and mentor and bring up to understand what HRC is going to become. Otherwise, we're not going to have someone to continue on. And if there's any greater thing I'd like to be able to do is to be able to mentor to someone to continue with the collaborative or with the effort to reform, reinvent healthcare. So we need to start inspiring and mentoring to those younger folks.
Oh, I love
Thank you,
that.
Virgil.
I'm a fan of Don Berwitz, and he mentions that really what he hopes to do is lay that path that the next generation will follow, that he knows he's not going to see healthcare transformed in his lifetime. And I think that we can only start it. The generations that follow will move it forward. I love that, Virgil. Thank you.
Yeah.
Sorry
Thanks,
to
Sam.
jump in. Yeah, Virgil, I love that point. It's okay. Just one comment on that as a kind of potential next step. The way in which we address what you've just mentioned there, Virgil, is that we partner with international universities, and then as part of our charity, we then do free mentoring and coaching with students who are in final stages of educational programs that are relevant to what we do. And then we pass on that transfer of value, talk about positive human impact, conscious capitalism, whatever it might be, international development, healthcare development, etc. And we have an exchange with the universities with students who are studying relevant degrees. So yeah, just wanted to say, love that point, Virgil, and that's something that I'd love to get involved with if that was an HRC approach to trying to take that out to universities and communicate with young people. But yeah, really cool point, man.
Yeah, good follow-up, Lee. Thank you.
And Jerry, would you like to speak to our points that we came out of our conversation with?
I'm more commonly hosting meetings and not used to the auto mute.
Oh,
Yeah, I can amplify a couple of these, but I think the others have also touched on some of these. The concept that there are multiple dimensions to the concept of diversity, not just the ones that get all the media headlines. So there's neurodiversity, and in healthcare, there's people that have had experiences with awful chronic illnesses versus have not. We have a rural-urban divide. I mean, and that segued into a conversation about, well, what is the role of considering intersectionality in embracing diversity, because most people have multiple traits in a diversity frame, spreadsheet, and the voice of a neurodiverse person that is also a person of color in rural Mississippi may not be the same voice as a neurodiverse person in New York City. I also want to compliment HRC for embracing diversity at a time when most organizations seem to be running away from it. It's going to take courage to stay the course on that and take decisive actions. And then thanks, Denise, for noticing. But the comment that I kind of trailed off as we got called back was we started a conversation about, at one level, it is, I'm going to say, just a matter. I know that's simplistic, but it's just a matter of being curious about all humans and entering into conversations where you build on common ground. We all have family members that are in various degrees embraced by the healthcare system. Let's put it that way. We want them to get well. We want them to be healthy. We don't want them to be mistreated or not heard or dismissed because of their concerns. That seems to me somewhere in there is a theme that can transcend all these different categories, because we've fallen into thinking about the healthcare system as the one that we know, which of course is what we're trying to fix. But in reality, what is the healthcare system there for but to make people well? Had a little conversation about, so this is another aspect of diversity, those that embrace self-care versus those that don't. And what happens when we promote a point of view that says, we want to reinvent healthcare by making it less needed.
Right.
Or reinvent healthcare by not diverting so many resources to administration and marketing, or fixing medical errors or things like that. Because, and I haven't done any sort of research on this, but I'm pretty sure that if you take away from the healthcare system all the stuff that's not actual healthcare, or is preventable or avoidable, the problems that we're dealing with would be far easier to solve. Can you imagine? I've seen quotes as high as 25%, at least in the US, 25% of the healthcare money is spent on administration and marketing. Imagine if that money was unleashed to actually make a better clinical care system. Oftentimes we struggle to find pennies in the sofa to do activities like this. Can you imagine if there were billions of dollars that were made available to actually do systems level improvement versus administration, marketing, waste, fraud, and abuse, avoidable care, those kinds of things.
What a great question, Jerry, to leave us with and our minds to kind of roll around with as we move forward from here. That's great. I know from my other conversations with you that you've got lots of little gems such as that to share.
Well,
Thank you.
thanks. I mean, I'm an engineer by training, so you always start by trying to reduce the scope of the problem, if you can. I mean, and that's where you get into things like lean thinking and what have you. And if you can simplify a problem, you don't have to build as many systems and processes to monitor it. You don't have to build as many systems and processes to repair it, because it's just inherently simpler.
That's right. Perfect. Thank you, Jerry. So we're going to transition to collaborative conversations. If you're able to stay with us for the tagged on 30 minutes, now about 25 minutes. So thank you so much for joining us. Dawn, did you have last comments on the event?
I wonder if we want to offer an opportunity for people to ask Dom any questions, or if we should jump into collaborative conversations.
Well, I think if there's a question for Dom that
maybe they can meet him in a collaborative conversation, or what do you think?
Sure.
Is he still here? Oh, there it
Trying
is.
to see if, yep, he's here. Yep.
Yep, Dom's still here.
It was the hat. Yeah.
That's right. That's right.
Well, whether people have questions for Dom or not, on behalf of all of us, we really want to thank you for being here, Dom, and for giving us a lot of good context around what we need to be thinking about to foster a more inclusive, diverse group and organization, and the efforts that are going to go into that. So it was great to have you here. It's great, all the people who are here and who have participated in this conversation.
Yes. Thank you so much, Dom.
Does anyone have a burning question that they want to ask Dom before we do jump into the collaborative conversations?
Yeah, I'll ask one. Let me add my voice of thanks to what you shared before. But, given that there are all these various dimensions of diversity, how do you not get overwhelmed? I mean, we're all human. We have limited bandwidth. There are all sorts of guardrails around our behaviors and things like that. So, how do you make sure you in good faith, enter into every interaction, being mindful of all these different dimensions of diversity without frying your brain?
Well, that also goes back into what you were discussing earlier about self-care. A lot of us have our own individual routines. Like Dawn specified in my intro, I love red wine. So that's my self-care.
Gotcha.
I also have a good community. And so one of the, I'm part of a lot of different organizations, nonprofits in some of my local community, but also I've created a DEI community. So myself, along with several other DEI professionals, where we get together. We have very much conversations to where we're able to vent, and so I can kind of discuss openly, and so any strategies, frustrations, and so because being a DEI and so expert, and so it's very stressful. It's on the professional.
Yeah, I can imagine.
So it's we definitely need that way of venting our own personal frustrations, so that we don't necessarily take it out on our clients. So
well, okay, that's really interesting. Thanks. So you have the ability as a professional in this field to surround yourself with reminder systems to keep this frontmost in your mind. So somehow people like the HRC, which are not professionals in the DEI community, need to replicate a version of that so that they keep these same questions in the forefront of their minds as well.
Absolutely. It's basically just having an accountability partner.
Yeah. It's like doing a little centering meditation before a meeting or something, little things like that. Okay, gotcha.
All right.
Or we could have you watch us.
Looking over our shoulder.
Yeah, there you go.
That's right.
Our guardian angel.
All right. So let's go ahead and get ready to jump into the collaborative conversations.